Okay, so rising and reporting from in camera, I have a recommendation here that effective May 1st, 2017, Mike Burbick be promoted to Environmental Services Supervisor, managing the operations of the Park Street and Cayley Street facilities, and further that a part-time 20 hours weekly maintenance repair person be recruited for the Park Street operations and a full-time 35 hours weekly be recruited for the Cayley Street operations. Do I have a mover and seconder for that recommendation? Ann and David, are there any further discussions on that recommendation? Hearing none, all those in favor, opposed if any, that is carried. Second recommendation is that subdivisions of the ITS division be created, named and rebranded to align with the nature of the current and future work as follows. And further, that the second service desk analyst position currently vacant be redefined to a system support analyst position, reporting to the lead of infrastructure networks and design, and begin with an internal recruitment process. Need a mover and seconder. Moved by Mike, second by Ann. Are there any further discussions on that recommendation? Hearing none, all those in favor, opposed if any, that is carried. Thank you. All right, we will invite the folks back in. Sounds like a dentist's office, doesn't it? No, here in Walker. That's over at the jail. So if we didn't have the jail. But it's just not the jail, it's the whole, what do you call it? The offenses, like the jail, not the jail, but the court. Yes, that's what I meant to say, yeah. So just a little more than, the jail's a small part of it.
It's just
Thank you.
not good.
All right, we will go to action item A first, which is the statutory holiday pay highways, sorry. Mary Ann?
Thank you, through you, Warden. The background of this particular item is that the Human Resources Department was provided direction December 8th, 2005 to offer winter seasonal highways employees a minimum of 4 hours of statutory holidays. We now have a system in place that automatically calculates that with our Avante system. So by continuing to manage with this particular direction, we have to have manual intervention. So what we're proposing is that our seasonal highway drivers be paid like all other staff at the county, and we meet minimum employment standards with that payment, and that it would be calculated with the system. So the recommendation is that the Human Resources Department be provided the direction to discontinue offering winter seasonal highways employees a minimum of 4 hours for statutory holidays and recognize the Employment Standard Act calculations for the payment of holidays.
There's the staff recommendation. Do I have a mover and seconder? Ann, seconded by Robert. Discussions? Hearing none, all those in favor, opposed if any, that's carried. Thank you. Action item B, HR policy C12, percentage in lieu.
Thank you, Warden. So in this particular instance, the county recognizes that a fair and equitable compensation program is important and establishes policies designed to support this goal in compliance with applicable legislation. The County of Bruce is currently conducting a non-union job evaluation and market review project. As part of this project, the consultants have recommended that the policy C12 be adjusted and incorporated as part of the county's compensation policy. As a result, in advance and in preparation of the JALP evaluation and market review project completion, we respectfully request that policy C12 in lieu of benefits be made redundant. So the recommendation that the Human Resources Department be provided direction to rescind policy C12 in lieu of benefits.
There's a staff recommendation to a mover and seconder. David, Janice, any further discussions? Hearing none, all those in favor, opposed if any, that's carried. Thank you. Here. Okay, next up we have the report on the Workplace Mental Health Program, which I know there's been a lot of time and effort put into this. And Eleanor, I believe you're going to present the report. Please. The podium is yours.
So I'm actually going to start.
Oh, sorry.
That's okay.
I'm just so excited about hearing this that
So through you, Warden, thank you very much for that. We're obviously really thrilled to be able to provide this information on this report today regarding Workplace Mental Health Program. So the Workplace Mental Health Program is created for all staff with a focus on prevention, intervention, recovery, and return to work. The program provides support to staff dealing with mental health issues related to work or not, which allows for a work culture with a supportive mental health environment. The proposed county program dealing with workplace mental health has two parts. Firstly, the mental health and safety policy, and second, the workplace mental health program. The first year of implementation will focus on building awareness of mental health in the workplace. In the course of the first year, feedback with staff will support the ongoing development and refinement of the county's mental health program. At the end of that year, the program will be reviewed for improvements and enhancements to the document that you're going to see today. Council will be presented with the Workplace Mental Health Program that is based on broad feedback from the county workers in response to concerns at both the corporate and front lines. A themed startup event, Start the Conversation, is planned for the purposes of launching, and we will be talking more about that as we move forward. So we really appreciate the support that we've received so far, and the support has been through our 9 joint health and safety committees and also through our wellness committee, and of course the work that Eleanor McEwen has done on the policy and the program has been just stellar, and we thank her for that. There are some financial considerations to be thought about as we go forward. There is approximately in training $5,000, and this is for leadership training that is planned for May, and also in some workplace materials to about the cost of $4,000. So we are implementing a Not Myself Today program at $2,500, plus that estimates the supplies over the next year to run the program as well. Once the mental health workplace program has been established, the county may also wish to seek the Excellence Canada Silver Mental Health at Work certification in the future. This certification means best practices are outlined in the voluntary CAN-CSA National Standard of Canada for Psychological Health and Safety in the Workplace program. If this were pursued, it would be to the cost of $22,000 for the first certification process. We have had interdepartmental consultation. The Mental Health and Safety Program and the Workplace Mental Health Program have been approved by the senior management team. The proposed documents have also been shared with the county's Health and Wellness Committee and all 9 of the county's Health and Safety Committees. Comments from both groups were shared with senior management team and incorporated into the policy and the program documents. So I'd like to now turn this over to Eleanor McEwen, who does have a PowerPoint for us today to go through that program.
I might have to move your doll. This is my doll.
Entitled Mental Wellness Exploring the Journey is certainly a journey for us developing the program and if we will. And so in the branding and inappropriate new images and talk. We challenge ourselves to take a little strategy. And I believe going down this path with mental health, we certainly embellished that into this program, and we look forward to going beyond the obstacle into our future. So, starting the conversation.
Actually, Eleanor, just a second. I'm wondering if, could you go to the mic just for our guests that maybe are joining us?
Oh, sure.
Because we can hear you. I'm just concerned that maybe the people.
So shall I start over? Okay. So I was just moving some slides around because there is one missing, and I apologize for that. But if you look at the front of the workplace document, there's a beautiful image of hands layering on top of each other. And I just wanted to take a moment to acknowledge that Chris Irvine from the museum helped develop that image, and it is certainly within the branding guidelines. And one of the things that's purposely chosen is the green color in behind the hands, because green is to mental health as pink is to breast cancer. So green is the color of awareness. And I just wanted to take a moment and explain that image. And it will be linked to all communications into the future of our mental health program. So I just... This is a video clip, and I'm not sure how to activate that from this podium. So, Darlene, if you could perhaps start that. This is Dr. Goldblum, and he expresses in a very beautiful way why it's important to consider mental health in the workplace. Mm-hmm.
You know, when some people say to you, "Hi, how are you?" It's often an empty rhetorical question. You don't really want to hear the answer. And if somebody says, "Not so good," or "Not myself today," are you prepared to stop and listen? We need to start conversations in every workplace where the question of how someone is has meaning.
So Dr. explains why it's important to look at this in the workplace, but what difference does it make? So when there is a mental health in the workplace issue, there's a list of topics there that how it impacts. So going back to what he said about 1 in 5 Canadians struggling with mental health or substance abuse issues, and what does that mean here at Bruce County? And what that means is of your approximately 625 permanent staff, there's more than that, but this is your permanent staff, that would equate to approximately 125 staff who are dealing with a mental health illness or a substance abuse, which impacts work. So this will make a difference, that's for sure. So approaching this to make sure it stands in time to be an effective program will occur through the cooperation of our health and safety programs, our individual employee efforts, and the culture that's in place. And by raising awareness, working on education, having the environmental support and policy development that Marianne's already talked about, will make it a successful campaign into the future. So a workplace is not always part of the problem, but we can always be part of the solution. This program focuses on prevention, intervention, recovery, and return to work, and it's based on the principles of mutual respect, confidentiality, and cooperation. There is a systemic framework to address the workplace factors that will affect our psychological health and safety in place. And I think that's the most important thing that excites me about this program, is that with that system in place, there will be longevity into the future. The health and safety program has been changed. It focused previously on health and wellness and the physical work environment. Adding a new pillar of workplace mental health program will strengthen the outcomes of all health and safety programs. So what is a psychological health and safe workplace? It is one that promotes employees' psychological well-being and actively works to prevent harm to employees' psychological health due to negligence, recklessness, intentional or unintentional acts. And while it's important to look at both of those, ensuring safety is the priority over promoting health, but we will work on both throughout this document. So there's 13 well-defined professional organizational factors that impact the work. It impacts not only the work environment, but the staff while they are at work. And when all of these 13 things are in balance for the organization, we offer a healthy place to work in. When these things are in balance for the employee, they come to work healthy and productive. But sometimes these things are out of balance, and what happens then are risks in the workplace, including stigma and discrimination, stress, work-life balance problems, presenteeism, and that is maybe an unfamiliar term for you. So presenteeism is when people come to work, they sit at work, but they're not as productive as they can be because of lack of focus or behaviors that take them away from performing the best that they can. There's potential for job burnout, harassment, violence, and bullying in the workplace, and then the substance abuse as well. So it's important to look at it. I talked to you about the framework and how important it is to me to have had this included into this document, because without a framework, the risk is that this could have been a document that sat on a shelf. So with the policies that Marianne has already articulated, one certainly changes our harassment policy, and it has included discrimination as a part of harassment in our workplace, which will fall under the guidance of that document. And having a whole policy dedicated to mental health and safety is a testament to where the organization is going to go. There will be an assessment of the workplace, and part of that assessment will occur through a staff survey and an organizational survey. Your leadership team will assess the status of the workplace by answering questions linked to the 13 factors that were on previous screens, and that will be compared to the survey results from the staff. It's important for you to understand that this survey will be occurring because the results of that will come back to you, and then there will be an action plan for improvement developed from that. The senior management team will make priorities based on those two surveys, and they will work with the Health and Wellness Committee to create action plans for improvement into our future. There's already a proposal in front of you that includes training for our leadership team, and there have been two external resources that we have leaned on in the development of this program. One is the Not Myself Today campaign, and that's where some of the tools that are in front of Darlene have come from. And that is an awareness program that provides these educational tools, not only for the staff, but for the leaders to resource as we address these issues into the future. And the survey and the tools to respond through action plans from that survey come from a Guarding Minds at Work program, which is free of charge from a professional Canadian health and safety resource. So it's exciting to have those two components in our program. And finally, here's to the explorers, here's to us. Bruce County is where the road less traveled become a journey in time, in work, in our communities, and how we spend our days together. Those are the words that have been chosen to be on the front entrance of your council chambers. And when we take the time to look at that statement a little bit differently, mental health does impact the journey that many people are on in their time, in their work, in their communities, and how they spend their time together. Not only at work, but in their private and personal lives. And that's what the intent of this program is to give everybody the best time, the best work, the best experiences in their community and in their lives. And I look forward to seeing this rolled out, and it's a real testament of the vision where you want to go. And in closing, I just wanted to say that the theme of the first year is to start the conversation. And I have a real privilege to talk to a lot of people about conversations. And I think one that sticks in my mind the most is my conversations with Kelly over the last few months. She has a passion and a desire to see this put into place. When she says she's thrilled about this program, she means it. She feels it and she expresses it. So to have that leadership in a program like this is totally awesome, and I believe it'll be a characteristic that makes this program successful. Thank you.
Very good presentation. I will open it up to committee for comments or questions. Anne.
I agree. I've read a few programs like this and over the years, and I think I've just read the report. I haven't read the things you handed out today, but I just think it's excellent. Covers all the bases, in my opinion, and I'm looking forward to hearing how it's implemented, and I think it's the time and money invested will be great for everyone, and there may be a few dollars invested, but I think there'll be a huge return on that investment.
Good. Other comments? Just with the survey, are you going to hand that out to all employees, not just permanent, but all employees working for Bruce County?
Thanks for asking more about the survey, Mitch, because it's a foundational element in the future of this program. So the survey will be distributed electronically to all staff who are working with us, all staff, and it is 100% confidential. It gets a link to them, and when it's completed, it goes to the Guarding Minds at Work depot, I guess, and they tabulate everything. We will not see who has responded, and so it's a very secure survey. So we're hoping with the assurances of that to our staff that they'll feel confident and protected in completing the survey.
Any idea on, do you think everyone will fill out the survey, or is there numbers in the past? And when they do fill it out, will they be honest?
Well, one thing that I have worked on and created is some messaging around the survey. So before the survey goes out, there's a communications that clearly explains what the survey is intended to do, that it is 100% confidential, and I've created a FAQ, so a frequently asked questions document, to help support the survey, and the assurances for confidentiality are going to be there. After that, it's up to them.
Okay. Other comments? Kelly?
Through you, Mr. Warden, I want to pay particular mention to Eleanor because she has led this initiative, and the contributions of John Van Welden, Emily Patterson, and of course Marianne has really allowed us to get to this point, and the program that they collectively have defined and the feedback from the health and safety committees has really taken us to a place and time. Our starting point in and of itself is just truly incredible. The survey and going through all the elements of the program, a tribute to the senior management team. It's difficult. It's a difficult conversation to start because you can't see it, you can't touch it. But you know when you see someone who is suffering, you know they're suffering, and to all of the individuals involved, I'm absolutely thrilled that we're at this stage. I'm happy to be able to articulate, just before we go into the balance, and assuming that you approve it, the team have put together invitations, and invitations will be going out across the region, including to our neighboring counties, to the medical officer of health, to the lower tier CAOs, the presidents of our hospitals, and we're hoping everyone will attend the launch in May, assuming that you're supportive of the program and the policy. So with that,
And May 4th, that's the day of county council, is that correct?
pardon me?
That's the day of county council?
Yes,
Okay.
yep.
If I may add that during that week is the Canada Mental Health Awareness Week.
Yep. Okay, so we do have a staff recommendation. I would let Marianne read that.
I'll just jump a little bit into the policies before I make the
Oh, sorry,
recommendation.
sorry.
Thank you, Warden. Human Resources, in support of the Workplace Mental Health Program, reviewed an updated HR Policy E1, Workplace Harassment Policy, to address harassment in the context of mental health and inclusion of stigma and discrimination reduction as a critical component of our program. Further, a new HR Policy E24, Mental Health and Safety Policy, was developed to recognize the importance of psychological health and safety in the workplace and the promotion of a positive working environment where management and employees collaborate to achieve the county's goals while promoting both physical and mental health consistent with the principles of mutual respect, confidentiality, and cooperation. The recommendation that the Workplace Mental Health Program be approved and the following policies related to the workplace mental health be adopted: HR Policy E1, Workplace Harassment Policy, which was updated, and HR Policy E24, Mental Health and Safety Policy, which was newly created.
You've heard the recommendation. Do I have a mover and seconder? Anne and Robert. Are there any further discussions? Hearing none, all those in favor? Opposed, if any? That is carried. Thank you again. Okay, motion to adjourn. Anne and Paul, all those in favor? Opposed, if any? That's carried.